Hi guys, good morning, good afternoon, good evening, depending on whenever you're going to be watching or seeing or coming across this video. My name is Anora Jennifer, your beautiful Anora Jennifer, beautiful mother of two adorable kids. So today guys, I really want to talk about, don't mind where I'm sitting, there's no light and this place gave me enough lightning. Guys, I'm using a front camera because I want to be seeing myself. I'm using a front camera, and again because my front camera is very very clear, and this is Samsung. So guys, I want to talk about this particular topic or this particular issue that has been going on, and I feel it's been neglected here. If you're a waiting mother, first time mom, or you're trying to conceive, this video is for you. If you're currently pregnant and this is your first child, this video is for you. Yes. So stay tuned while we dive into this video. So guys, let me pin this thing here. I don't want my hand to be paining me. Okay, I think it's better now. So guys, you know me, I like hitting my hand whenever I'm having a serious conversation. So guys, I want to talk about this particular issue that is going on, and that is, can all these mothers that feel they've had 20, 30, 3, 4, 5, 6 experience, can you people allow new moms, awaiting mothers, to enjoy their pregnancy? Like, I mean, can you people allow them to have their own experience? Because I realized that when a lady gets pregnant and is her first child, there is no kind of advice that she will not hear from different people. Don't eat this, don't eat that, don't eat this, don't eat that. If you eat this, it will make you fat, it will make your baby fat, it will make your baby's eye go one side, it will make your baby add weight. Can you people allow them to breathe? Allow them to have their own experience. Allow them to have their own labor experience. Everybody is different. Do you know that someone went as far as telling a lady not to take folic acid after 3 months, after her early stage, that is after 3 months, that once she entered second trimester, she should not take folic acid? Odogo of them all. Folic acid for that matter. Hey, God. Like, I remember when I was pregnant with my child, with my daughter, my first child, they said, it's your first child. During your labor period, during your delivery, they're going to tear you. Is it episiotomy or something? I don't know what they call it. Medical stuff. They're going to tear you. They're going to do this. They could use razor blade, tear you. Do you know, I was enjoying my pregnancy. And I'm this type of person. If you say, don't eat this, don't eat that, that is why I have a gynecologist, right? Exactly. So if they say, don't eat this, don't eat that, and you're craving for it, especially snail, they say, don't eat snail. Me, I don't eat snail normally, naturally. They say, don't eat snail. It will make your baby to add weight. It will make your baby to be bringing out spit from he or her mouth. Your baby will be pouring spit when the baby start growing. That is why you have a gynecologist. Go and meet him or her. Sir, ma, please, can I eat this? What are the things, the kind of fruits I should eat? Because a lot of, okay, I was saying something. I said, they're going to tell me, blah, 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 blah. As time goes on, I was enjoying the pregnancy. If I remember, they say they're going to tell me, the fear of being awake, no injection, and I'm going to have a tear by my doctor. I was so scared. But do you know that the funny thing is, doctor did not even tell me. Before doctor will even climb up and come, my baby is already out. I had tear. My baby's hair gave me just small tear, just small. And I didn't even know when they stitch it. Doctor did not give me injection. But going through labor pain already, waiting one pain past the pain that I went through. You see, Mr. A might have tear, Mr. B might not. If you tell Mr. A, if you not tell Mr. A, B. So because your village people follow you enter labor room, that does not mean another person's village people will follow them to their labor room or delivery room. So you have your own experience. Allow other people to have their own experience. Not because, okay, you went through 16 hours labor, 16 hours labor, and you were expecting another person to go through that 16 hours. No, you might even go, another person, Mr. A might go through 16 hours labor, and Mr. B might go through 10 or 5 or even 6 hours or 8 hours labor. Everybody is different. Everybody's body hormones react differently. So when somebody, see, you that just newly got married, if you're pregnant, you go hear plenty advice. Just nod your head and go and meet your gynecologist. That is why you have a gynecologist to take care of you. The gynecologist is the best person to take care of you, to tell you what to eat, drugs to take. They are the ones to give you, prescribe everything for you. Because, okay, I went to Antenatal the other day, and the doctor's wife was telling us a story of a lady. It's her first child. She just got pregnant and she started spotting. Instead of her, and she was worried, instead of her to come or call her gynecologist that, oh, see, oh, her neighbors, the people that feel they've have experience, they've given birth to 3, 4, 5 children. They told her that it's normal. I beg, I want ask una. How it they be normal say you get birth and you dey spot? You're spotting, you're pregnant and you're spotting, and somebody say it's normal. I don't understand. Is that not what they call attempted miscarriage or abortion or what? Okay, she now feel relaxed and said, oh, they said he's normal. She stayed at home. She spotted for 2 days. She stayed at home. Nothing. Most times, spotting can be caused by stress or anything. I don't know. But I know stress can cause it. And she was at home. The 3rd day, she had miscarriage. They had to rush her to the hospital. That day, the woman said, it'd be like me doctor even give her a slap because I don't understand. It's even 2 stories. I don't understand how you be spotting instead of you to call your gynecologist and you're listening to the self-medication. That was how she lost the child. Will you tell me that her next time, if she take it next time, she will listen to anybody? She will run to the hospital. She'll be your get. Then the second one, she's pregnant. I think she's 6 to 5 months pregnant, and her water broke. They told her again, it's nothing. It's, she didn't even know that it's her water that is coming out. But she told someone that something like water coming out. I say, it's not my, that's how pregnancy is, blah, 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 blah. Hey, the water is just like your baby's life is cut short. Water where they give your pikin life is coming out. And somebody is telling you it's normal. You go sit down, you go wet, and you're not bothered because somebody said it's normal. You're relaxed. Hey, most times, spotting all those water, your gynecologists know how to manage it. They might put you on bed rest. Please, because a lot of people are doing this mistake and they are losing their child. Most of them are losing their pregnancy. Most of them are even losing their life in the process because you're listening to you are craving for okra. You want to eat okra. They will tell you when you eat okra, your baby will do this, your baby will do that. Can you people please allow allow Adobe to have her own experience of pregnancy? During labor, you go through your own labor. Allow another person to experience their own labor, to have their own labor experience. My own labor experience and your own labor experience might not be the same thing. It is not even the same thing. So all this a lot of advisors when you're pregnant and it's your first, a lot of people will come with different advice. Please run to your gynecologist. If you want to eat anything you are craving for, as far as it's healthy food, my sister eats, chop. You want to eat mango, you want to eat it with the back, eat. You want to eat 100 snail, eat. Snail is healthy. Me, I know they chop snail normally, but it's healthy. I have seen a lot of pregnant women that eat snail and nothing happens to their children. You want to eat obono soup. They say don't eat obono soup. Oh, ha. The same thing they said that the snail will do to your child. That's what they still tell you, that obono soup will make your child to draw, to be bringing out spit. Please allow mothers, allow expectant mothers to enjoy and have their own experience. Make una no dey put fear for people body. If you went through 1 week labor delivery, that doesn't mean another person will go through that same thing. Everybody's body is different. There are some people that there are some first timers awaiting mothers that might even be in labor. They might not even know they are in labor. They just tell them, ma, thank God you came on time, or you're already 5 cm dilated, and they will be shocked. Maybe the pain they will experience maybe 2-3 hours. They've given birth. Some people don't even experience this pain that some of us experience. Like somebody like my mom, she said she did not experience it though. That she was, and she gave birth to twins. She gave birth to me, I senior twin boys. She said she was just, I thought me was just telling her like somebody that I want to see her nurses. She went to the office, they told her that she's in labor. It was when she was pushing that she felt that one. But that contraction, it was coming in her own way. It was happening to her in her own body language. Not be say you die, you cry, you shout, you tear your hair. That doesn't mean another person will experience the same thing. Say your village people follow you, no means another person will experience the same thing. You get? So you people should allow pregnant women to breathe with your plenty advice. Now don't put so many people for problem. Okay, let's, I don't even want, this video is already getting long. Oh yeah, now let's talk about after childbirth. When I was going home with my daughter, our gynecologist, the doctor called us and said, he says, you see the way people are going home now, a lot of people are coming with their plenty advice. Don't argue, just say okay, just say yes, you've heard. When your child is running temperature or you're seeing something that you don't understand, please call me on phone. I will tell you what to do. If it's what you bring the baby to the hospital, I'll tell you to bring her. Let me check. Because they will tell you, go and buy this one. Go and buy Bobo Riche. Go and buy one herbal medicine. That is what I use for my child. You can't go buy and go use them for your pikin. You go enter problem. You will enter problem. Her pikin and your own pikin not be the same thing. So when you give birth to your child, you hear different advice, different kind of stuff. What worked for me might not work for you. That is it. Sometimes you give, maybe you've been like, if you're my friend and you've told me, I've used so many things, it didn't work, and you mentioned you've not used what I use, I'll say, okay, you can try this. I use it for my child, it worked, it might work. It's not now you forcing it and doing it as if it's compulsory that person use it, use them, go work, you're very sure it will work. No. And the person might use it, it will work. The person might use it, it might not work. That is how it is. Don't need to make it as if it's na that one, na that thing they work. So please, when you give birth to your child, you see, and you're a first time mom, you see some reactions you don't understand, please consult your doctor. Doctor, you sometimes if we even get to the hospital, that's me. I'll take my child to the hospital, doctor, I don't understand. So say she's fine, it's just normal rash or something. just get this, get that, and use it, and that is it. So please stop self-medication, stop listening to plenty advice, especially when you're pregnant, so that you avoid complications during your delivery. Avoid complications during your delivery. Take your drugs. Some first time expectant mom, they be like, some people self go, they tell them, why not they go antenatal self, wetin una dey go they're good. Eh? Wetin una dey go they're good. There's no need now. Is there every time you be going for antenatal? Hey, most times you go for antenatal, you see doctor will check like that thing where they check for your belly. You just say they don't know what they do, abi. Most time what they even teach you in your antenatal, when you go to antenatal, you might experience it, but because they've taught you, you've already know what to do. Because they've taught you, this is when this thing happened, this is what to do, this is not what to do. But when you do not go or attend anyone, when the thing is, when you're having the symptoms, how are you going to know what to do and what not to do? That is now when you start listening to people. Don't do this or do that or eh? I don't shall talk waiting, I won't come talk. Because when she was telling me this particular one that had miscarriage, I said, no, I think I'm going to do a YouTube video about this. I'm going to make a video about this because I've heard so much. I beg, when people are pregnant, allow them to enjoy their pregnancy, allow them to have their own labor experience, so that when they give birth, they will talk their own, they will speak their own. Like there's some people that when they want to deliver, they will tell them push like 20 times. There's some people that they don't even tell them push. Before she go even climb, the baby don't come up on her own. So everybody is different. Okay. So I'm going to stop here, and I hope you learn something from this video. So please don't forget to subscribe if you've watched to this very moment. Thank you so much. And don't forget to subscribe, like, comment, and share. I'll see you guys in my next video. Okay? Peace out.